It was only in October of 2012, which is just a little bit over 2 years ago, that the American Society of Reproductive Medicine made a formal announcement to say that egg freezing is no longer experimental. Up to that point, it was always considered experimental, and it quite literally has changed the entire landscape of how we think, how we act, the options that we offer to patients, and really it's opened up a whole new horizon for patients to come and see us with a single thought in their mind. Should I freeze my eggs? Should I take out that insurance policy that I hope I will never need? We already know that the best quality eggs happen between ages 20 and 30. That's it. That's why I told you about my daughters, okay? That's when the eggs are at their prime, best. That's not to say that a woman between age 30 and 40 is it's hopeless. It's not. But the best, the peak is 20 to 30. So we get asked by the 39-year-old often, should I freeze my eggs? Well, it's better than 41 or 42. It's not as good as it was when you were 29, but nobody can turn it backwards. So we are where we are. We can't go backwards. So the answer should be yes. If you're thinking
So during a natural cycle, your body basically, Dr. Russ often used the analogy of the food that you're feeding to the animals, and only a few of them grow. What we're trying to do is start them all off at the same level, give them all food, so they all grow at the same rate, so that we can retrieve all of the mature eggs at the same time. So during ultrasound, we want to make sure that all these follicles are growing to be between 18 to 20 millimeters in size, and that also your blood work matches that as well. So the blood work has to also show that these follicles have a mature egg in them. So we're monitoring you as you go along. So based on your insurance program and your protocol, the medications will be selected for you. There are about 4 different kinds of medications that we use. Some of them come in very handy little pen devices. Now the injection, the needle itself is very small, and I'll pass it around with the needle actually connected. The medicine is inside the vial, and all you do is dial up your dose. Okay, very easy. The needle gets inserted. There are 2 caps on this, so please be careful when you pass it around. And the needle itself is very tiny.
So what's very important is having someone skilled who can freeze and thaw the eggs. During the cooling and the warming process, if ice crystals form within the egg itself, it will kill the egg. So someone had asked, when we freeze eggs, are they just as good as fresh? They're just as good as fresh if they're handled correctly. These are the eggs now at 100 magnification. Okay, so even more magnified than that, but this is what I'm looking for. At this point, you see the zona pellucida, the shell that surrounds the egg. You can see that we call that a polar body. That's the egg only has half the genetic material, right? Because the other half genetic material comes from the sperm. Well, when the egg is formed, it has full genetic material, so it has to extrude or pop out that other half of the genetic material so it's ready to receive a sperm. That's maturation. That's when it's a mature egg ready to be fertilized.